Hello again. I'm here with Dr. Brandon Koretz, who is co-chair of Geriatric Medicine in the David Geffen School of Medicine, and he's also the chair of our Undergraduate Research Week Council. Dr. Koretz is a practicing physician and a professor in the Department of Medicine, where he won the EB Award for the Art of Teaching. He received his MD at University of California, San Francisco, and also an MBA from UCLA's Anderson School of Management. His very timely topic is geriatric medicine at UCLA in the COVID-19 era. And for we beyond boomers, Dr. Koretz, we need all the help we can get.
Thank you very much. It's first of all, a pleasure to be here and very exciting to be part of the first virtual undergraduate week, research week, I should say. I guess the hope here has been to engage with people and be available to answer questions that come up. The thought perhaps being for me to start by explaining a little bit about UCLA's approach to COVID, and then open things up as participants may have questions about themselves, their families, and so on and so forth. First and foremost, we should just pause and acknowledge the incredible work that everybody who is doing anything in this endeavor has been contributing to our society, whether it's people working in a hospital, people delivering food, people helping us in the markets, people helping us with our mail. What's been overwhelming is that for every single act of somebody being less than kind, I personally have witnessed hundreds of acts of generosity and kindness. And that to me is perhaps the most heartening thing that's happened here. So with regard to the way UCLA has been thinking about how to approach COVID, we've sort of divided our healthcare perspectives into two buckets, the inpatient side and the outpatient side. Obviously, the inpatient hospital side is for those who have been more greatly affected, people who are more acutely ill. We've seen pictures from certain cities in the East Coast where hospitals have been just beyond overwhelmed. Fortunately, here on the West Coast, in particular here at UCLA, we've been the happy recipients of a lot of good luck and a lot of good planning. We have been able to maintain hospital censuses that have allowed us to care for everybody who needs care. We've had plenty of resources, everything from gloves to ventilators for those who've become gravely ill. We've consciously acknowledged that people who are affected by COVID are both at risk to other people in their families as well as people delivering care. And so we've done the very best we can to try to sequester and people who are either at risk of having COVID or who have active infections, so that the risk of transmission is as low as possible. There have been specific COVID teams that have formed, all volunteer, which have allowed us to concentrate our efforts, concentrate our experience, and concentrate our knowledge so that people who are affected get the best care possible. What's been truly remarkable is that in an incredibly short period of time, UCLA has activated a number of clinical trials so that we can not only provide the highest level of care in real time, but make treatment options available for people under experimental conditions so that we can learn from our current patients and apply that knowledge to people in other hospitals and around the world. The magnitude of this collaboration is beyond imagination. These are trials that can typically take months to years to prepare, and yet here we have over something like a dozen that are ongoing that have been activated in a matter of weeks. This is an incredible credit to all of our colleagues who work in clinical research, who work in hospital operations, and who are there on the front lines, as well as the patients and the families who are having this experience and graciously committing to help other people literally around the world. The second component has to do with how we look at COVID for the outpatient setting. So for people who develop this infection or who are at risk of developing it, we're doing everything we can to provide care in as safe a mechanism as possible. We have activated video visits and telephone visits on a scale that is mind-boggling. Prior to this, in a busy month, we might have 100 video visits. Now we've been able to scale up that capacity, and so we have done literally 2 orders of magnitude more visits every single month because it's safer for people. We have outpatient COVID teams so that if a patient is identified as having COVID, these folks get daily visits, virtual visits, with a team of physicians and nurses who are following best care protocols, monitoring patients' symptoms, observing them for changes in their condition, and if they are unfortunate enough to get sicker, we're able to escalate their care to the right place at the right time. In terms of geriatrics specifically, our team's practice is really reserved for people who are 65 and older. Not surprisingly, we skew older. We have patients in their 80s, 90s, and 100s. Our teams have been particularly mindful of the enormous burden that COVID places on our patients and their families. When patients come to the hospital, they're not able to have visitors as we would usually like. This is to protect them and to protect their families, but it becomes harder. And so we're doing everything we can to arrange for video visits between patients and their families. Similarly, when we have patients who are isolated at home, we're doing everything we can to reach out to them. We are in the process of piloting some new video programs for people who have extremely limited resources and need both equipment and training to utilize video visits. The care, I think, that we've been providing has been really heartwarming. We're trying to address both people's medical questions as well as their psychological concerns. When folks are sequestered, it can be quite scary. Let me just pause for a second and see if anyone has any questions at this point. Yeah, so one of the questions here is, as the country is starting to open, how can we protect some of our most vulnerable in daily activities? So I think protection here has a number of aspects. One is the physical protection from the virus. Here, being very thoughtful about social distancing, about masking, and about minimizing unnecessary interactions with people who are frail is important. At the same time, we can't allow our people in our community to become isolated. And so reaching out to people whom you know, who are either family members or live in your communities, is going to be incredibly important. A call, a FaceTime visit, any acknowledgement that they are important, helping deliver food. These kinds of gestures are critically important. They help keep people's morale up. And I think the reality is we're likely not to need this for a few days, but a much longer period of time. building these things into our daily activities, helping our own families and the people in our community is going to be very important. The next question is, do we anticipate the practice of geriatrics to be significantly impacted by COVID-19? I think the answer is absolutely. I can't imagine that there's any aspect of our lives that won't be touched by it. There are a couple of ways that I envision that this will change things. One is the advent of telehealth, video medicine. I think for many, many situations, that's a perfect solution. But that being said, sometimes people need to be seen in person. So when they come to the office, we are in the process of setting up mechanisms to ensure social distancing. We screen every person at the door, literally, to make sure that they don't have fever and don't have symptoms that could be concerning and could indicate that they're carrying the virus and spread it. And then I think lastly, we're instituting a number of similar types of safeguards for our patients in the hospital.
If I'm live throwing a question, in this era of telemedicine and teleteaching and all those areas, how do you, as a physician, as a caring physician, how do you maintain that doctor-patient relationship with the screen?
So
Which is secret.
Yeah, no, I think that's an excellent question, and I think it's something that's much broader than just the relationship between a physician and a patient. It's how are we all going to maintain relationships in this time? I think the single most effective technique that I've seen role modeled is the technique of listening, active listening. Ironically, there's something about Zoom or these video visits that lends itself very well to that. It's about pausing before you speak, making sure that the other person or other people have completed their thought. It's about not thinking ahead. It's about engaging with what people say. That to me is the most powerful thing that I've seen. I think, candidly, if all of us did more of that in our face-to-face practice, we'd all be better off. Here, the irony of this artifice is that it forces us to do that. I think that's very powerful. When we look back at our early, or when I look back at my early medical academic career, how did I interact with research? So I had a great opportunity, and this is candidly what brought me to participate in UCLA Undergraduate Research Week as an undergraduate, to work on a pregnancy test for hyenas. Now, this sounds absolutely nuts, but it allowed me to have access to wonderful professors, wonderful resources, and it really got me thinking about answering questions in a very scientific way. Because of those opportunities, and because it sort of put me on a path to academia, I feel I have an incredible debt that I have to pay forward to another generation or another series of generations of undergraduates. Someone believed in me. Someone thought it was worth teaching me to do this assay to develop this test. And while candidly, I'm not a hyena gynecologist or a hyena obstetrician, it's the thought process that sparked in me, actually. And the fact that I now have an opportunity to light sparks for others is a wonderful chance. Another question that other people have asked, and maybe this is the best for my parting thoughts, is what is it that people can do for themselves or their family members? I would urge you to think about a rule of three. Make sure that every day you do something physical, make sure you do something intellectual, and make sure you do something social. even though we're all relatively isolated, there are ways to connect with other people, to use our brains, and to stay physically active. Those are probably the best three practices for being healthy and getting us all through this time. Anyway, if there are any last questions, I'm happy to take them.
Dr. Koretz, thank you so much for your time. Thank you for leading the council and the extensive work you're doing, both with your patients, but also with the young researchers here at UCLA. Thank you so much. Take care.
Be safe.